Okay, okay, the recording's on now. So, well, good day, everyone, and welcome to today's teaching. Today, we're going to talk about autism. Again, it's not a topic that we often talk about, but it's more common than I think we realize. And for children who have autism, there are issues that they face when they interact with health services. So pediatricians and healthcare workers and parents and teachers all need to know about autism or the autism spectrum disorder. So we'll talk about that today. More common than you realize. When we think about types of developmental disabilities or developmental problems, we um, we more commonly think of cerebral palsy or epilepsy, intellectual disability or hearing loss or visual loss, but there are also some disorders that are some problems. I wouldn't call them disorders, but some problems that are related to communication and language and to some extent behavior. And that's autism spectrum disorder, and also another condition called attention deficit and hyperactivity disorder, which we won't talk about today. But I just want to focus on the autism spectrum disorder because, as I say, it's more common than we realize. It may occur in up to 1% of all children and even more common in some environments. And so it's actually quite a common condition that you'll see in your practice in outpatients and in hospital-based practice, and it provides some challenges for healthcare workers, I think. I wanted to start with a case, and this is a child that I saw a year or so ago. This was a boy named Mikey. He was a 5-year-old boy whose parents brought him along because he just wasn't speaking normally. He had several words, but they weren't at all clear. So, for example, for juice, he would say oos, and he had other sounds, guttural noises that represented what he wanted. And his parents understood. His parents understood what the sounds meant, and they could respond to his sounds. But he had very few fully formed words. He could walk and run seemingly normally, but not to command. If you ask him to do something, he wouldn't actually do it. But sometimes he did what his parents told him, but then he would become distracted. And occasionally he would do what you ask him to, but he would become quite distracted. His parents were usually able to calm him quite well and to allow to persuade him to do things they wanted him to do. He fed himself and he sat with support. He could walk and run normally, so his motor skills were quite good, but he was very shy and he didn't make any eye contact. And he had little interaction with other children. His parents would say he would never play with other children, and actually he had very little interact with anybody else. He didn't like making eye contact with doctors or nurses or even mostly with his parents. He didn't make much eye contact. He played with one toy. He had one toy and he played with that constantly and had little interest in other objects. Anything you could show him, he was very uninterested in, but he would like playing with this one particular toy, a brightly colored toy. His parents said that was very frightened of sirens and like ambulance sirens or loud noises, and he didn't like being touched. And that was a big problem for Mikey when he was in the hospital because, people would try to touch him or put in IV cannulas or check his observations, and he didn't like that at all. He just liked to be not have his skin touched at all. And he was sometimes quite impulsive in terms of his movements, but he was rarely aggressive. He wasn't an aggressive child. He's usually just very quiet and he would sit and play by himself. So this is, I suppose, when we think about development, we think about the fine motor skills or the gross motor skills, such as head and truncal control, and at different ages, rolling and sitting and crawling and walking and running, those motor milestones. We think about those things, and we sometimes think about fine motor skills like arm and hand control and finger control and the use of objects. Mikey was okay with all of those things. And his vision seemed to be normal, and his hearing seemed to be normal. He had actually very sensitive hearing, it appeared to be, even though he couldn't respond so well to commands or requests for certain things, but his hearing and his vision seemed to be normal. His problem was with socialization or with communication, socialization, language, communication. And so that puts it in much more in the domain of the autism spectrum disorder. I just want to, normally when we think about domains of development, we might use a chart such as this to look at gross motor, fine motor, hearing and vision. So when you use this sort of chart for a patient with autism, what you'll find, for example, with Mikey, he was able to do most gross motor things fairly well, up to at the level you'd expect for his age. But his fine motor skills were impaired more by his only interest in one particular object. So it was a bit hard to assess, but certainly his language and his language and his communication, his socialization were very much impaired. And so I think you have to, if you're trying to make an assessment of whether a child has a developmental condition such as autism, you need to go beyond gross motor, fine motor, hearing and vision and consider a child's socialization and language. So in summary, his motor function, his strength, and it was all normal for age. He didn't cooperate with the motor testing, but you just had to watch him move. And his hearing and vision appeared normal, but as I said, it was a language and socialization problem. And autism, the autism spectrum disorder, that's one name for it, autism spectrum disorder, is a neurodevelopmental problem of socialization and communication. And it was a surprise to me to see how common it is. And the studies that have been done suggest that it may be up to 1% of all children have some level of autism. It might be smaller in some parts, from about 0.1 to 1%. So one in 1,000 to 1 in 100. So this review estimated that one child in 93 had autism in the South Asian region. Even more common in some parts, in some studies, in some environments, such as in urban Dhaka in Bangladesh, a study showed that it was up to 3% of all children had some degree of autism spectrum. And it is a spectrum, so it can be from very mild to actually very severe. And Mikey had a sort of moderate to severe form of autism spectrum disorder. He had autism of a moderate to severe degree. There are other terms for it, such as Asperger's syndrome, which is usually a milder form of the autism spectrum disorder. And sometimes, not always, sometimes these children have quite high intellect. So even though their language and their communication and their socialization is different to other people, they often have very high intellect, not always. Most children with autism, like Mikey, don't have a very high intellect. Their intellect might be normal or a bit lower than normal, but they usually have a normal or slightly lower than normal intellect. An old terminology used to be pervasive development disorder. That's really gone out now. It's rarely used. So mostly we talk about the autism spectrum as an overarching term. When you look at the autism spectrum, you can see how closely that aligns with certain things that this patient Mikey did. There's usually a marked impairment of eye-to-eye gaze. When you approach a child with autism, they don't engage you with their eyes, and their communication gestures are just not normal for their age. They don't develop peer relationships, and they usually have quite a close relationship with their parents, but it's not quite the same. Especially early on, their parents will often say, well, they don't give them a hug as normally, or they don't show affection as normally. But parents usually learn to interact and communicate with their child who has autism, and learn to support them and teach them certain things. There's this notion of a lack of socio-emotional reciprocity, which means that if you provide some sort of overtures, emotional overtures, friendliness to a child, they won't always respond like you would expect another child of their age. They often play alone, they resist being hugged or cuddled, they have difficulty expressing emotions, and they're sometimes quite unaware of other people's feelings as well. So if someone else is feeling sad or distressed or in pain, they won't always show any reciprocal emotion to that, which children normally would. They have delayed language. Their normal language is quite delayed, and they have an unusual form of language often with just single words or sounds. And they sometimes use language for what is considered their own self-enchantment, which means they use language to be to entertain themselves rather than to communicate with other people. They'll often have a stereotyped or ritualistic behavior, maybe a fixation on one object or one particular activity. And some children with autism are like Mikey, quite light and noise. Well, Mikey was noise sensitive, very sensitive to loud noises or people talking. He liked things to be very calm. Other children are very sensitive to light, who have and touch sometimes, as I mentioned with Mikey. They often have what's called repetitive movements or motor mannerisms. They're not seizures, they're just motor movements that they do on a regular basis, on almost constantly. And sometimes they have aggressive behavior, but usually that's environment dependent. If they're in their right environment, if they're at home, if they're being looked after by people they know, by their parents, etc., then usually they're not aggressive at all. They're actually quite quiet kids. Whereas if you put them in the wrong environment, in say a hospital-based environment, then often they appear to show aggressive behavior. It's just because their environment is wrong. And sometimes, sadly, some children with severe autism have self-harming motor physical movements, such as head banging and things like that. That's on the more severe end of autism. It's a lifetime condition, autism, but often it's not identified until a child's around about 2 years of age. It begins much earlier in life, and sometimes symptoms manifest in like from 9 months of age onwards. Parents will say the child is not interacting normally. They're not engaging with them as a normal child would, not responding to verbal stimuli or anything. And of course, one wonders in that circumstance whether the child's got some other form of neurodisability like cerebral palsy or vision or hearing loss. But it becomes usually fairly obvious by the time the child is 2 or 3 years of age that the symptoms are manifesting mostly in terms of language and communication and socialization rather than in the motor developmental domains or in vision and hearing. Often it's very subtle at first, and it becomes more manifest as the child grows. The frequency is much more common in males. The prevalence in males is 3 times that which it is in females, although some studies suggest that female autism spectrum is underdiagnosed, whereas males a bit more frequently diagnosed. So it might be that it's not quite as the disparity between males and females is not quite as great. And as I said, there's a very wide spectrum of severity. It can be from quite mild, quirky sort of behavior, difficulties with language and socialization, to something that's actually quite severely disabling and outwardly manifest with behavioral problems as well. So we shouldn't think that all autism is the same. There's a very wide spectrum. The causation of autism is quite complex. We know that there's I think I spoke to this in the genetics lectures. There's around about 50 or 60 genes that are linked to autism. Not one gene that causes autism, but many different gene mutations that are linked to autism spectrum disorder, ASD. And we know that there's some defined genetic conditions such as Down syndrome or Fragile X. Fragile X is is the most common cause of intellectual disability in males. It's called the Fragile X syndrome, and it is associated with a certain facial phenotype. And then Rett syndrome, which is a disorder of separation in girls. It almost only occurs in girls. And tuberous sclerosis, which is a neurocutaneous syndrome where children have cafe au lait spots. These defined genetic conditions are are associated with autism. So while some children with these conditions have autism, most children with autism don't have these conditions, but they may have one or more of the other genetic links, not causation necessarily. But we do know that there's some other environmental conditions that are associated with autism, including extreme prematurity, and babies that are born less than 26 weeks gestation, more likely to have beyond the autism spectrum in terms of their development. They might not have cerebral palsy or that sort of thing, but they may develop some level of autism spectrum. And certainly we know that from other environmental examples, we know that sensory deprivation at a critical period of development can look very much like autism spectrum. And so you might be familiar with in the 1990s, there was many children found in orphanages in Romania. When the Ceausescu regime was deposed, there were many children in Romania who had been put in orphanages at a very young age, and many of those children looked very much like they had autism spectrum disorder. They had all the features, but the cause of that wasn't autism itself. It was just extreme, profound sensory deprivation of a child who's in an institution. There's also some interesting studies showing that cerebral malaria is linked to autism. That is, that some children who survive cerebral malaria may have as an ongoing neurological sequelae the features of autism. And then we know that certain other infections like congenital rubella syndrome is associated with autism. And then there's other issues around epigenetics, which I talked also a bit about in the genetics talks, where again, sort of extreme sensory deprivation or child abuse or particularly child abuse in a very young age can be associated with features of autism in children. So again, multifactorial causation of autism. You just need to understand some of it's genetic, some of it's environment, I think. There is no diagnostic test, and I wanted to go through the case of Mikey because I think it's the way we make the diagnosis is just a clinical assessment, and you can start with the clinical assessment of the basic developmental issues like gross motor, fine motor, hearing, vision, etc. But as part of that, there's an assessment of speech and language and behavior and communication and interaction with parents and other people. And it's those areas that you then find where the biggest problems, the biggest issues are. It's important if you see a child who you think might have autism to rule out other conditions that mimic autism. So some children with profound hearing loss will have major delays in language. They won't necessarily have the other features, the other socialization, emotional issues, but it's very important to know that those children that you're considering that might have autism, you make an assessment of their hearing, and again make an assessment of whether or not the child has had a sufficient, I would say, opportunity for social, language, emotional development. Because some children who aren't isolated in orphanages are still within families where there's no social stimulation, no educational or no one speaks to the child, and that they may develop psychosocial deprivation to the point that they may have manifest the features of autism. Sometimes children with autism will have other comorbidities. They may also have epilepsy, for example. They may also have intellectual disability, but don't assume that they all have intellectual disability. Some children with with mild autism, certainly Asperger's syndrome, have a higher intellect than normal, and many children have normal intellect, but they can't manifest it because they have language problems. I've struggled to call this talk about autism spectrum disorder because many people who have autism, they don't want to be considered a disorder or a problem or an issue or a disease. They just see themselves as being neurodiverse. They're just different to other people. Now, that's not the case for the more moderate or severe forms of the condition of autism, where but it certainly is the case for people who've got a mild degree of autism, and certainly for those who've got Asperger's syndrome. So I was interested in just how common autism is and how it differs in different countries. Sometimes we imagine that autism is just a condition of Western countries, rich countries, but actually it's not. And there's been some good studies done from Africa, from India, from Egypt, from Pakistan, Bangladesh, China, Taiwan, all looking at the frequency of autism and looking at the features of autism, and it's very similar across the globe. There are some differences though. In these lower income countries, in lower income settings, it appears that children are diagnosed at an older age, and I think that's probably because of just delayed recognition, because there's not as much awareness of autism. There's seems to be, certainly in the African studies, an increased proportion of non-verbal cases. So not all children with autism are non-verbal, but many of the studies in Africa suggest that a higher proportion of children have non-verbal autism. They don't speak, a bit like Mikey, actually, like Mikey, not able to speak and just making guttural sounds. There is a higher proportion in lower income countries, especially in the studies in Africa, of possible infectious causes. And as I said, many children have been described post-cerebral malaria as having the features of autism. And of course, there's a lack of recognition by healthcare workers because there's not as much awareness of it. And in many such countries, the studies suggest that autism spectrum disorders is often attributed to not the causation that I've mentioned before, the genetic and environment, but just traditional or spiritual causes, and that becomes a problem with stigma and other things related to the child. I want to just talk a bit about treatment and the management of patients who have autism spectrum. There's no specific treatment, but there are some really good studies showing that children can improve with early intervention by supporting their learning and their communication, their motor skills and their social skills. So training in all of those areas, social skills training, communication skills training, that really does make a big difference. It's best if it starts early, and it's best if it's quite intense, quite regular. So there have been some good programs in India and Pakistan and China and Taiwan where parents are educated about autism, and they're given a program to do, because children with autism can't come to a health clinic and for enough hours in the day to have such treatment, but it's better if parents do it. And so parents need to be very informed about how to do social skills training and communication training and motor skills training, and sort of the whole package of early intervention. And many parents are able to do this in these programs in India and Pakistan, in other parts of Asia, and to get very substantial improvements in functional outcome for their children. There aren't any drugs that actually help with autism. I mean, many children with autism are on medications, but there aren't any drugs that actually help autism, the condition itself. Sometimes, though, if children have other features like depression, or they have aggressive behavior in any environment, then that can be very troubling for parents. It can be very, very difficult for parents and for teachers. And so for some such children, then there is a medication that's been the subject of many studies called risperidone. That has been, as I say, used in many studies, suggesting that it does effectively treat the problem behavior of children with autism, including aggression. But again, the best way to treat the problem behaviors is to modify the environment and make the environment something that is conducive to the child, rather than putting them in an abnormal environment and then sedating them or giving them antipsychotic medications. There are some, I think, quite interesting other studies of children with autism that have come from mostly from low income settings. And I think this is very, very useful, because they're not medications, they're not drugs that will sedate the child, but they're other interventions that have been appropriate in those environments and have had some benefits. So there are some there's a close connection, I suppose, between gastrointestinal function and autism, and that is seen by some interventions that people have used, such as using probiotics, which are different to antibiotics. They're actually like lactobacillus and bifidobacterium, healthy bacteria that can change the microbiome of the gut. And for some children with autism, at least in 2 studies in Egypt, it showed that improved their gastrointestinal symptoms, but also their severity of autism. There's been some good studies on yoga, 2 studies on yoga for children with autism in India. Again, a place where that sort of therapy, yoga, is a very part of natural therapies for people with illnesses of all descriptions. And that is also said to improve gastrointestinal symptoms and sleep problems and behavior in children and adolescents who have autism. Again, some other acupuncture has been done, said to improve communication and language. So some of these complementary therapies, L-carnitine is an amino acid that is said to improve, in one study anyway, autistic behaviors. All the studies that have been done on complementary therapies for autism have been quite small, and I would say they're not proven therapies, but I think it's interesting that they may have a role, whereas I think most drugs that sedate or can have a detrimental role on patients' functioning, generally speaking. I just want to finish now by talking about the difficulties that children with autism face in the health environment. And mostly when we're seeing children with autism, it'll be because they're admitted with something else. They may be admitted with pneumonia or admitted with some other intercurrent illness. And the problems that such children face are very intense for them. It's a hospital environment is a very threatening foreign environment. It takes them away from their normal routine, and people who have autism are very much more comfortable with their normal routine. Often health staff, doctors and nurses, they underestimate the child's intellectual ability, and they might assume the child is quite severely intellectually disabled, when in fact they may be able to understand the things that are said to them. They just might not be able to respond. And often their behavior is interpreted as being aggressive, so they're labeled as being aggressive children or aggressive people, but actually most of it, in my experience anyway, is mostly fearful behavior out of fear. They're trying to protect themselves or sometimes protect their parents, but they're mostly behaving in what seems like an aggressive way, but they're actually fearful. And it is very difficult for such children in hospital environments. I certainly know in my intensive care, we have a lot of problems. It's a very, very foreign environment for children who have autism, and the only way to do this, to address this, I think, is to try to reproduce an environment that is comfortable for the child. And that's hard in a hospital, but certainly have parents present at all times. Their parents are like the best, social link with the child. They're often the only social link with the child. So, and find out from the parents what the child is normally like. How do they normally function? What do they like and what do they dislike? It was a revelation to me to realize that some children with autism have an intense dislike of being touched. And so if someone tries to examine them or tries to give them medications or put a drip in or something like that, they will have often an intense dislike of that, and they will react sometimes in what seems like an aggressive way, but also find out what they like. They may like a certain type of music, or they may like a certain type of lighting or something. I certainly usually when children with autism come into my intensive care unit, usually the parents, I encourage them to bring along their child's playlist that might be on their phone or something, and they can play the music that the child likes, and often that has a very calming effect on the child. You should always speak calmly to the children, regardless of whether they have autism or not, but more importantly to children who have autism and developmental problems in a reassuring and calm way. And try, as I said, to reproduce the normal environment, whatever their normal environment is at home, with their normal routines. Get the parents to bring in whatever object they like to, they're interested in, and as best as you can, try not to over medicate such children. I'm aware that many such children get antipsychotic medications and sedative medications when they're in hospital, but actually what's better is to treat them and then try to get them back to an environment that is normal for them. Sometimes, of course, you need to use some sort of medications to control them, but it's best to try to control the environment or change the environment to something that they are comfortable with. So that's all I want to say about autism. In summary, the prevalence is unknown, but likely to be quite common. So somewhere between 0.1 and 1%, and even up to, as I said, 3% in some urban areas where the environment may be different that may make autism more common. It is an impairment or a diversity in language and communication. Usually other functions are not so affected. And it can be treated with early intervention, and particularly with parent programs for skills training and social skills and communication skills and motor skills, early intervention. And the outcome for children who receive early intervention is much improved. And I think we all need to be familiar with this condition, and as best as we can to adjust the environment in a hospital to fit the child if we can, and that comes by working closely with parents. And we all have a role to reduce stigma and try to uh, educate other people about this condition. Certainly teachers, if the child is going to school, need to be very well informed about autism, and it's our job, I think, to try to inform parents so that they can then help their child with early intervention if they can. So that's all I want to say today about this developmental issue called autism. I hope that's been useful, and I might stop there and see if you've got any questions. I'll just stop the recording now and take any questions that you might have.